Hi again, in this video we will discuss about the fluid prescription, how to prescribe fluid for everyone really, starting from the patient who are on the sepsis pathway, or we are resuscitating him, or the patient who need maintenance, or for the refeeding, or for the patient with heart failure and AKI, and for the patient who are diabetic. So we will discuss a lot about fluids today and how to prescribe it clinically, how to do it on the paperwork, how to do prescribe it on the system. But before we do that, there's some videos I need to show to you how to put a cannula, how to take some blood culture first, right? Because they are very important videos. So I will start with how to put a cannula, how to cannulate the patient first, right? Let's start with this one's only 2 minutes video.
Leave the tray to dry and gather the equipment, placing the items on the trolley beside the tray. You will need a tourniquet, an alcohol wipe, some gauze, a cannula, a bung, a dressing, a syringe, a red or green needle, a vacutainer barrel, blue connecting device, and the appropriate blood bottles, and at least 5 ml of sodium chloride for injection, which must be checked with a qualified colleague. Wash your hands again. Some trusts require that you wear gloves and an apron whilst assembling the equipment. Adopting a sterile, non-touch technique, attach the needle to the syringe, draw up the saline, and keep the key part of the syringe clean by storing it in the packet. Dispose of all sharps safely in the sharps bin. In this video, we have used a tray with 2 chambers. We use one chamber for equipment out of the packet and the other chamber for those that remain in their packaging. The vacutainer barrel and the blue connecting device must be assembled prior to the start of the procedure. If you are next to the patient, carry on and perform the procedure. If not, remove gloves and apron, wash your hands, and reapply at the bedside. Position the arm to optimize venous dilation and filling. Speak to the patient and tell them what you are doing. Apply the tourniquet 7 to 8 centimeters above the chosen cannulation site. The tourniquet should be tight enough to pinch the skin, but not so tight that it will cause pain. Palpate the vein and once again ensure you are confident in proceeding. Clean the skin with the alcohol wipe according to trust policy. It is important not to repalpate as you will contaminate the skin. Anchor the vein with your free hand. Insert until you see a flash of blood enter the chamber of the cannula. Gently lower the angle, insert the cannula another 2 millimeters, slide the cannula over the needle until it is fully inserted and the coloured part is flush to the skin. Release the tourniquet. Place a gauze under the cannula to collect blood spillage. Carefully withdraw the needle and dispose of it into a sharps bin. This is the point at which you may now take blood from the cannula. Insert the barrel and connector into the cannula. Withdraw blood in the usual manner. Remove the barrel and connector and attach the bung. And clean the surrounding skin if necessary. Secure the cannula with the dressing and flush with the sodium chloride.
So this about how to put a cannula in. The other thing is about how to collect the blood culture, because I did find some of my colleagues struggle when I asked them to have some blood culture to be collected. In this video, quickly, 2 minutes again, we will have a look how to prepare and to collect some blood culture. We never collected from the cannula, as I saw some people doing that. Okay, let's have a look and see what they are doing. So again, the same, but this one is a little bit bigger, and we just will remove the book and the inner book cap, and we'll clean it with the alcohol swab. You will have two alcohol swab, one for each, and again 7 to 8 centimeter above the veins that you are going to, and you will palpate the vein to make sure that where you want to put your cannula in, and this one will be again non-touch technique. All right. Using a butterfly, you will insert it in the vein and collect the blood culture. Okay, the blood culture will be collected from the vein where we are not putting a cannula in, and after we're doing that, we will send it over to the lab for further testing. That's fantastic. Let's go back to our topic today, which is fluid prescription. So fluid prescription, which is the most one of the most actually it is the most important thing in the hospital settings, because again, if the patient has whatever sepsis, maintenance, you will prescribe DKA, you will need to prescribe hyperkalemia, you need to prescribe some stuff, hypokalemia, you will need to prescribe some stuff. We will talk today just short to talk about how to prescribe fluid, all right? So the fluid, they are, if we can say, there are two main types of fluid, which are the resuscitation and the maintenance. The resuscitation fluid, which are sodium chloride 0.9%, and usually we would use this one and if the patient blood pressure has been dropped, or in patient sepsis, and these the guidelines, you will find it there. You can read it easily. All right, everything is there. So the resuscitation, how to resuscitate the patient. So you put the cannula, you put and you secure the line. So how to prescribe the fluid. So the first thing we will do, let me share something with you. So I'll share now. We are discussing the resuscitation fluid. This is a fluid chart. You will put the patient label and the name here, and then it's time now to prescribe something. So the patient has no heart failure. The patient has no heart failure. He is dehydrated or he is in sepsis, and his blood pressure being dropped to let's say 80 over 60. So you will write the date for today. It's 8/10/10/24, and the fluid you will prescribe again is sodium chloride. Sodium chloride NaCl 0.9 percent. Is there any KSL inside? No. What is the volume of it? How much you will give in the resuscitation? 500 mils. Over, we called it stat. Stat in less than 10 minutes. That's a stat. And this is for resuscitation. Okay. Usually you'll find the reason, or where you'll find another tab, you will put the reason, and you will put your signature and put the bleed number. All right, you did that, and the patient still blood pressure low. What should you do? Again, yes, again, 10/10/24, and yes, we'll need to give the patient again NaCl and 0.9 percent, and how much you will give him. We are talking about resuscitation now. 500 mils stat. Okay, and you will put your signature and the number, right? What if the patient had heart failure and he is on heart failure treatment and they are giving furosemide all the day in the morning and the patient blood pressure has been dropped to, let's say, 75 over 40, and they called you, hi doctor, this is a patient who has been treated from heart failure, he is now having very low blood pressure, what should we do? Again, we have nothing else, it is sodium chloride, fluid in ACL. How much will give him? Yes, 250 mils, 250 mils. And is it stat? Yes, in less than 10 minutes. Okay, and you will put your signature and put your number. All right. Okay, so how many liters you can give as a stat? How many liters? 2 liters. 2 liters. 2 liters to make the blood pressure higher. What if the patient have heart failure and you are treating him from heart failure and his blood pressure has been dropped? 1 liter, and then you will seek help from the registrar and ITU to find out what should I do, what is the next step. All right, good. So in heart failure, remember we are giving the half dose of the normal resuscitation fluid, which is in ACL, and 0.9%, and how much you will give for the heart failure or for the overloaded one with hypotension, or in I will give 250, and you'll put your signature and put your plebe number. Easy like that, easy like that. It is easy like that. This is the resuscitation, all right? Okay, so again, if the patient is still hypotensive, you will need to repeat the same scenario again to save your patient. To save your patient. Okay, so this is about the resuscitation. In easy words, we are talking about clinicals. No much talking about what should I do and what we will replace and blah 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 blah. No, we are talking from the clinical point of view only. All right, good. So you had a review for the patient today, and there was the you was or you have been told that you need to prescribe maintenance fluid for the patient, as the patient has a fluid chart, urine output, and the input output chart. How much shall I prescribe to the patient? What is the fluid I should prescribe to the patient? All right. Okay. Have a look with me. I'll show you something really important. In every fluid chart, you'll find or this stuff written there. Okay, so this is the first part of it. This is the approximate daily healthy needs. Right? Okay. So and then you will find some guidance here about how much electrolytes present on each bag of fluid, which is sometimes you need to know that, and especially if you are dealing with the refeeding syndromes. Okay, and you will find some advice there as well, something like Hartmann is safe first choice in the 24-hour post-surgical replacement. We are in medicine, yeah, we can use Hartmann, of course, but again, sodium chloride. If you wanted to, the patient is bleeding and you need to give something, yes, you can give sodium chloride with potassium chloride. Yeah, that's good. Okay. For maintenance with the standard diabetic sliding fluid, okay, what you will need to do, you will need to give the dexasaline, which is there, dexasaline. Okay, yeah, you will memorize the numbers now what we are talking about now. Okay, and you will need to give some potassium according to the daily assessment. Okay, can you see something there? Never use dexasaline for fluid challenge or resuscitation. We only use one thing in resuscitation, which is sodium chloride. Is that clear? Good, good. That's fantastic. So let's prescribe some maintenance fluid for our patient. So you have been told that This patient came in with gastroenteritis and he's clinically dehydrated, and we need to prescribe something for him. All right. And his kidney function is not very well, and he is going to AKI, or he is in AKI 2. How much fluid shall I prescribe? How much fluid shall I give to him? So make sure the patient is not overloaded, make sure the patient is not having heart failure and overloaded, then you will prescribe. Again, the same clinical. What? Please save your time, save my time, tell me what to do. All right. Again, the date is 10/10/24. You have what has the date today? How much fluid? What's the fluid? What is the type of fluid you will give? We are talking about maintenance. So saline, saline. So what is saline? What is, so it is dextrose, it's 4%, and the saline 0.18. All right. This is the dexisaline. That's what I mean by dexisaline. Okay. All right. So this is the dexisaline. Okay. So the patient will need some potassium as well. How much potassium you will need to give? So dexisaline usually came in three types. Dexisaline 1 liter was 20 mils of KCl, or 1 liter was 40 mils of KCl, or dexisaline was nothing. Okay. So depending on what is the patient potassium, if the patient potassium is normal, you will give 20 mils KCl pre-mixed. All right. And how much you will give? 1 liter, and 1 liter over how many hours? Depending on the patient weight, really. Are you giving 2 liters a day or 3 liters a day? All right. There is a chart, I will show it to you right now. All right. So again, we are giving a maintenance. We're talking about the maintenance fluid. Okay, what is the rate? I'm giving, this guy is 60 kg only, and I'm giving only 2 liters a day. It's between 2 and 3 liters, but I will give the 2 liters only. He is coming with gastroenteritis and dehydration, and is not eating very well. All right. So over how many hours? Over 10 hours. All right. The patient is frail and old. Over how many hours? Over 10 hours. All right. And then you will put your signature and your bleed number. All right. Good. Is it only 1 bag? No, we said we will give him 2 bags. We'll give him 2 liters. All right. Okay. So if you are giving 2 liters, there is another liter remaining. So 10/10/24. And again, you will give dexisaline, and then now you know what is dexisaline is. All right. And you'll put the numbers if you want, and then how many fluids you will give? 10 mil of KCl on top of, and how many liters is it? It is 1 liter. All right. And over how many hours? Over 10 hours. And you will put your name and your belief number. Okay. So thank you very much for telling me that. But this patient, his potassium level was, when I came to see him earlier, he has hypokalemia. And his potassium is 2.9, and I'm not pretty sure if I need to give him something more than 20 ml of KCl. Yes, you're right. So let us prescribe it. So it will be again the same day, and the patient potassium there was very low, so you need to give again dexisaline. So dextrose 4%, and the saline 0.18. All right. And pre-mixed with KCl. How much KCl I'll give this patient? 4 mils. And what is the volume? It is 1 liter. And what is the rate? It is, let's say, 12 hour, 8 hour, 6 hours. How many hours? It's maintenance. 8 hours. So 8 hours. We are giving this patient 8 liters. We're giving this patient 3 liters a day. So, and you will put your bleed number and your signature. Good. All right. Actually, I need to prescribe more, but without this amount of KCl as a maintenance. So again, of course you will do some electrolytes after you're giving the KCl, and then you will give some maintenance again, dexasaline again. So dex 4% and saline 1/8, and you will give only 20 mils of KCl, and you will give 1 liter over 1 liter over 8 hours. All right, and you will put your number and your signature. Okay, can I give Hartman? Yes, yes, Hartman. So again, 10, 10, 24, and you will give Hartman, and it is 1 liter over 8 hours. Over 8 hours. All right. Notice that Hartmann contain only 5 millimoles, 5 millimoles of potassium. So it's not the best to replace the hypokalemia, and we will discuss about hypokalemia later on and how what to do and how to replace him. All right. So this is the maintenance. This is the maintenance. How to give the fluid, the maintenance. So we discussed in this video the resuscitation fluid and the maintenance fluid. Did you notice something? Did you notice something? We did not use glucose 5%. Don't prescribe glucose 5% until it's needed, and it is not needed usually. Do not prescribe glucose 10% until it's needed in hypoglycemia or so, and it's not in the maintenance chart. Do not prescribe glucose 20% for anyone until it's needed in hypoglycemia. We never prescribe glucose 5% for every single one in the hospital. Don't prescribe it, right? Give the normal saline, give the dexasaline as a maintenance, give Hartmann as a maintenance, all right? But not glucose 5%. Give saline only for resuscitation. Saline 0.9% only for resuscitation. 0.9% saline for resuscitation. Okay, so that's how we prescribe it in the hospital. All right, the date and the PIB number and your signature is really important, and you need to know how to prescribe. And now we will see how much should I prescribe, how much should I prescribe for the patient. All right, good. So let me share something else with you. I'll stop sharing here, and then I will jump to share the fluid prescription. All right, good. I hope you can see this one. This chart is really important, and this fluid is really important, and you will find it there as well. Please go and have a good read. All right, let's go to how much. So again, how much is a patient need a day? All right, usually we're talking between the weight between 70 to 100, something like that. So we're talking between 1.5 liter or 1,750 liter a day till 3,000, till 3 liters, till 3 liters. All right, so usually between 2 liters to 3 liters. Okay, you can find the amount of the fluid and how should I prescribe here on this chart. But usually, if you don't know, if you are not good at calculation, so it's between 2 liters to 3 liters, 20 mils per kg till 30 mils per kg. It is easy like that. This is what I'm talking about, the maintenance. All right. All right, so hopefully you got it, and it's easy to do, and it's really common thing in the hospital during the daytime, during the nighttime, during your on call, during your presence in A&E, where you are in the hospital. Someone will ask you, come and prescribe some fluid. Know how to prescribe, know how to do the fluid the flow chart as well. I didn't bring the flow chart here, but let me find something um, on Google for you. So let's open this one. So the flow chart usually will contain input and output. Let me find it. Where is that? Where is that? Just bear with me just a second. I'll try to find it. Accept all cookies. All right, and let me open it for you. Sorry for that. Just a second. Okay, there's a SharePoint and there's something else. And the fluid chart, was the one. There we are. Okay, so this one is the fluid chart. So the fluid chart, it's your responsibility to know how much the fluid have in and how much the fluid get out. And you do that on daily basis for all the patient with heart failure, acute kidney failure, all right? So this is the input and this is the output. How much the patient have oral, how many cup of tea he had, how many cup of water he had, how many fluid you give, how much fluid you give with the injection. And this is the output, how much is the patient urinate, how much is the patient having the bowel or the stomach, how much is the patient aspirate, vomited, and how much fluid in the drain if the patient had drains, right? And then you will do your calculation and to find out if it is positive, the patient didn't wee a lot, didn't give us a lot, or if it is negative, the patient give us more fluid than supposed to be. And you will do your calculation up there. You will do your calculation up there and find out the 24-hour fluid balance. And do not forget that the fluid balance is needed specifically for the patient with heart failure or kidney failure. And I'll stop here. I don't want to talk too much, but now clinically, you know how to prescribe and how to do your fluid chart thing in the hospital. And accordingly, you will know how to prescribe more fluid or not. That's all for today. And I will come back to you again with the refeeding syndrome and hypophosphatemia, hypokalemia, and hypomagnesemia, and how to replace all of this stuff. I'll see you next time.